Welcome to the segment on trigger point massage therapy. We perform this therapy on ourselves using an instrument called a Thera Cane. The Thera Cane is specifically designed with 6 points, 1, 2, 3, 4, 5, 6, with which we can reach every part of our bodies and apply direct pressure to all of the muscles in our bodies. In the next section, I will demonstrate how to use the Thera Cane to give yourself a full body trigger point massage. This segment will demonstrate how to use the Thera Cane for a full body trigger point massage. The full body massage begins at the back of the head, where we will massage the sub-occipital muscles and the neck muscles at the beginning. We'll then methodically work our way down the body, moving from front to back as appropriate. The first set of muscles that we wish to massage will be the sub-occipital muscles located right at the back of the head. You will be able to feel 2 small protrusions, one right here on the right side of your head and one right here on the left side of your head. And the muscles that surround these particular points on the skull are the sub-occipital muscles. So just begin with a massaging motion up and down around that particular part of your head. Do one side and then the other. And then just continue on down the neck muscles, right alongside the spine. And you may wish to move laterally across the muscle. Until you've completed the massage. To massage the Sternocleido mastoids, which are these muscles that run from right under the ear, where they insert right behind the jaw, all the way down to the collarbone here, you won't use the Thera Cane, you'll use your fingers. And you can just turn your head slightly and you'll be able to grab that muscle right between your fingers and your thumb. So just start down here next to the collarbone and just work your way up all the way, just finding any trigger points there that need to be massaged until you finally get up here right under the ear, right along the jaw, right there. And then do the other side with your other hand. Just turn your head until you can get a hold of that muscle right there. Now you're very close to your larynx and to your throat here, so be gentle with yourself and just make sure that you grab the muscle all the way up to the insertion here by the ear. You can use 2 fingers to massage right there along the lower jawline. And then down. Next, you'll want to massage the trapezius muscles, which run alongside the neck out towards the shoulders on both sides. Take the Thera Cane in your left hand down here at the base, and in your right hand for working on your right hand side. You're going to position it right here and sort of balance it here against your thigh. Once that's accomplished, take your left hand and place it at the top of the Thera Cane. This way you'll be able to exert some pressure on the trapezius muscles here on your right hand side. And just moving laterally across the muscle. Press as hard as you can, and if there is pain, because there are trigger points being massaged, you'd like to have a pain amount equal to 6 or 7 on a scale of 0 to 10, where 10 is unbearable pain and 0 is no pain at all. So when you encounter a trigger point anywhere in your muscles, try to massage them for about a minute or so and maintain the pressure so that it feels like a 6 or a 7 on that scale. That will release the trigger points more rapidly. Switching to the left hand side now. Right hand is on the base of the Thera Cane. Left hand is up here to position it on the thigh. And take your right hand on the top of the Thera Cane and begin massaging the left trapezius muscle. Now, 6 or 7 at the beginning is too difficult to maintain. That's fine. Use whatever amount of force with which you can be comfortable. Remember, this is not self-torture. This is just a simple, direct, effective method of relieving pain and providing an overall healthy massage to all of your muscles. You want to move the Thera Cane all the way out to the ends of the shoulders, all the way back. And then you're finished with the top part of the trapezius muscles here. Next, you'll want to take the Thera Cane and continue the trapezius massage. So you'll hold it like this in your hands, and then just bring it around and tuck it up over the shoulder like this. Now you'll have access to all of the upper part of the back, along the spine here, over the top of the shoulder blade, just along the spine, along the bottom of the shoulder blade, over the shoulder blade itself, around to the side of the shoulder, and continue on down, working along the deep spinal muscles right alongside the spine. And then move outward. These are the Latissimus dorsi muscles here. And then you can actually move the head of the Thera Cane all the way around along the ribs. This will get some of the intercostals all the way down until you begin to work with the Quadratus lumborum muscles down here, just above your pelvis. All the way around, we'll start to get some of the lateral abdominals. And just switch sides and do the left hand side. Exactly the same way. Just rotating along the side of the spine here, around the shoulder blade, over the top of the shoulder blade, around the bottom, down along the deep spinal muscles, the Latissimus dorsi here, up underneath the arm here to start to get the intercostals along the ribs. Down here, the Quadratus Lumborum, and around to get some of the lateral abdominals. From the position that you were just using, you can easily transfer the top of the Thera Cane around to the front of your body. Begin to massage along the ribs right here, the intercostals, the abdominals down here, all the way up to the pectoral muscles, all the way up to the collarbone. Pressing as hard as you need to in order to get a good massage. Under the arm, to get all of those muscles there. If you need to apply more pressure, you can turn it over and use one of these points. Even hold here if you need to get a lot of pressure. And then just do the other side as well. Same thing, the abdominals, lateral obliques here, intercostals along the ribs, all the way up to the sternum here. And getting the left pectoral muscle all the way up to the collarbone, around under the arm.